All right, guys, structural rehabilitative exercises here. Think of these as kind of like spinal hygiene. Now, we give these to most of our patients if we are concerned with their general posture. Overall, you're kind of slipping into that forward head position, hunching this way. These exercises are actually going to help offset a lot of that. Okay, so the first one is literally just straightening up. And so while this doesn't fix anything on its own, it's going to help with your progress in the office. Take a deep breath in, try to bring your head straight up to the ceiling. And then I want you bringing your shoulders down and back. This is activating those muscle groups that are congruent with having that healthy inline posture versus this here. Okay, so that's just the first one. The second one here is we're actually going to stretch and decompress and elongate our entire spine. And so what you're doing is you're going to take a deep breath in, bring your arms up to the ceiling. As they're up there, try to touch your hands together above your head, really trying to feel like you're stretching your spine out as long as it can go. And you'll hold that position and then come back down. And then you can repeat up again, deep breath in. As you breathe in, feel like your spine is kind of elongating and stretching as high as it can to the sky. And then arms come back down to the sides. The next one here is going to help with general spinal mobility. Most of us don't move our spine through its full range of motion on a daily basis, and so this kind of helps with that. And so the first thing you're doing is you just bring your arms up, your elbows to like a 90 degree angle with the shoulders, palms facing in front of you, and you're going to rock your arms backwards. Okay? As you rock your arms backwards, I want you to feel as if you're pinching those shoulder blades together. When you pinch those shoulder blades together, it activates a muscle group called the rhomboids. And the rhomboids are a major muscle group that help to keep us in this straight up, healthy posture, upright position. So that's the first part of it. The second part is this is the mobility component now, is you're going to lean as far as you can to the side. And as we're doing that, again, moving those spinal joints through their full range of motion, and then rotate up to the sky. Okay, and you can do the same thing this way and rotate up to the sky. Okay, and if you're an expert and you want to kind of combine those both at the same time, you can be doing this, pinching your shoulder blades together, and as you're doing it, you're also kind of coming off to the side, okay, and then rotating up. The last one here, it actually shows with your hands behind your head. Not necessary. If you don't have balance issues and you just want to do it like kind of with your hands down to your sides, that's fine too. We're going to strengthen the second muscle group that helps with this upright position with the head straight on top of the shoulders. They're called the deep cervical flexor muscles. The best way to strengthen those is with something called a chin tuck. And so that's what this last one shows. You're just standing up nice and tall and you're trying to bring your chin straight back like that. It almost feels like, or looks like you're giving yourself a double chin, but what you're doing is you're strengthening these deep cervical flexor muscles here. And so you'll kind of bring it back. You'll hold it for about 10 seconds or so, repeat 5 times. Again, if we're a bit older and we have balance problems, what we can do is we can bring our hands up here this way. It just kind of gives us a bit of stability so we don't actually fall backwards as we're doing it, or you can do it up against a wall if you want. But you can bring your arms up like this, and then you're literally just trying to kind of push your head back as if you're breaking through your hands. Or again, finally, again, if you're against a wall, just stand up nice and tall against the wall, push the chin straight back, hold in that position, and then relax, move your head around, go back, do it again. Okay. Performing those exercises daily, we call them spinal hygiene. Think about kind of like brushing your teeth for your spine. It's going to help with general posture and general spinal health.